I'm Alan Critchley, an independent social worker working for Kent, and I'm going to talk to you about Safeguarding Adult Review Mary. At the time of her death in February 2025, Mary was aged 75. She was disabled and had been so since a hypoxic brain injury following routine surgery in 2006. She met her husband in 1993, and her long term friends from the time described her as having a sharp sense of humour. She was also described as mischievous. Following her brain injury, Mary developed significant and enduring care and support needs, and over the course of 19 years, her mobility progressively deteriorated until she needed full time care and she was unable to communicate with words. In addition to the acquired brain injury, at the time of her death, Mary had cancer and she also had some pressure sores. Mary had lived in the house that she died in from the age of 7. She had a strong and understandable attachment to her home, and she said to her GP in 2023 that she wished to remain there and not go into a hospital or care home for the remainder of her life. She was supported by carers at the time of her death, but the main and consistent carer was her husband Leon. Mary's husband had been deeply affected by his wife's brain injury. He became very protective of her, and he was her main carer. He was with her throughout day and night. In the months before Mary's death, as her health declined, 3 safeguarding concerns were raised. In addition, healthcare professionals raised concern about the care received by Mary and the support provided by her husband. These issues led to the referral for the Safeguarding Adult Review. Now, what was our learning? We held a practitioner event, and all those who came agreed that more could have been done to support both Mary and Leon throughout her final months. There were also missed opportunities for multi-agency meetings and multi-agency information sharing. A multi-agency meeting may not have changed the outcome, but it would have been an opportunity to share ideas, use all available expertise, and potentially to have worked with Mary and Leon on building trust with the carers and the others working with the couple. There was a discussion very shortly before Mary died about what might have been different if she'd been moved to a cottage hospital. It's possible that she might have been more comfortable, the pressure sores might have been less severe, and her nutrition might have been better managed. However, she had been very clear in the discussion with her GP in 2023 that she wished to remain at home, and those wishes were respected. Turning now to Mary's husband, he'd been her carer since 2006, and there was no suggestion that his care prior to this timeline was anything other than very good. He was known to be cautious of medical intervention after Mary's brain injury in 2006, and the reasons for that are very understandable. By the timeline of this review, Mary's husband did not always follow the advice given to him by others working with Mary, and it was said in the practitioner event that this was to a degree not normally encountered when working with families. However, to put this in context, he'd been the one caring for Mary, and because of the history and the brain injury, he was very cautious of medical advice. He was also the one who was present 24 hours a day. Social care have identified that they could have got to know Leon better so that they could have better understood his practical and emotional needs. That could have been done during a Care Act assessment that took place in July 2023. One part of the learning from this is to use a think family approach, so consider both people in the household. Turning now to continuing healthcare, Mary was not considered eligible for continuing healthcare until the day of her death, although a previous application had been made a few months before. Discussions over the course of preparing this review did uncover that there was some misunderstanding of how continuing healthcare was assessed and accessed. They have been very helpful to the review in providing all their relevant records and information. There was consensus between health and social care that continuing healthcare was not required at the end of November 2024. A new application was made in February 2025 and was agreed, but only on the day of Mary's death. An application could have been made earlier for fast track care, or the previous decision in November 2024 could have been appealed. In view of the lack of understanding that the review saw with regard to continuing healthcare, I recommended that a workshop takes place with relevant parties to learn more about the continuing healthcare process, to look at the application process and the criteria and the appeal process. Looking at Mary's pressure sores, when they were initially identified, they were grade 2, and they eventually developed into deep tissue injuries. The advice for those was to move and reposition Mary every 2 hours. Given that Mary was in her own home, that care hours were limited, and that one of the carers was her husband, that couldn't be achieved. There was no suggestion that people were unaware of the guidance, although the guidance wasn't followed. Now, looking at good practice, for their part, the community nurses made Mary as comfortable as was possible at the very end of her life, and she was able to manage her pain through a syringe driver. There was also good and consistent positive OT involvement throughout the timeline of the review. The recommendations that I've made are 4. Recommendation 1 is that agencies involved in the review are to be reminded, using the learning from this review, that face-to-face meetings can be more effective than using email, phone calls, etc. Recommendation 2, the review supports the recommendations made in Safeguarding Adult Review Carissa and TED. Agencies involved in the review should ensure that appropriate assessments, such as risk assessments and carers assessments, are to be completed using a Think Family approach. Recommendation 3, that a workshop be held with continuing healthcare, social care and relevant health agencies so that the continuing healthcare process for application, assessment and appeal is understood. And finally, recommendation 4, agencies involved in the review are to provide evidence to assure the Safeguarding Board that the pressure ulcer guidance is embedded in their organisations, that it is used appropriately and that it's easily accessible to all workers. Thank you very much for listening.